All right, we're going to continue assessment of the eyes and the ears, and I'm going to start by asking a couple of questions. Paul, do you wear eyeglasses?
I do wear eyeglasses.
Which I can see you're wearing, and do you wear them for distance or for near vision?
I wear them for distance vision.
For distance, okay. And have you had any problems with your eyes, like glaucoma or infections or any other kinds of problems?
Nothing other than astigmatism.
Astigmatism, okay. And do you know when was the last time that they dilated your pupils and checked your eye pressure? Was it with your last eye exam maybe?
It was not.
Okay, so maybe a couple years ago?
A couple of years ago.
Okay, all right, that's good. It's important to check for, especially older people, checking the glaucoma test because we want to find that out early. So we started out, we checked your visual acuity using the Snellen eye chart, and now we're going to check your peripheral vision. So to do this, I'm going to have you take this card and put it over your left eye. You can put it in front of your glasses probably. There you go. All right, and I'm going to cover my eye just for comparison. And then you're going to look straight at me, but you're going to tell me when you can see my finger by just saying now.
No.
Okay.
No.
And then I'm noticing also when I can see
No.
it so that I have a comparison. Look at me.
No.
All right, and then switch. If you find that your patient is seeing the finger before you, it's because you have your finger over here instead of over here. So say when you can see my finger.
No. No. No.
And then one last one.
No.
Wonderful. Okay, we're done with that. That's checking peripheral vision, and that's cranial nerve number 2. And then can you take your eyeglasses off for just a moment? All right, I want you to look at this. And I'm going to move this, and I want you to keep your head still, but follow it with your eyes. What we are checking here are the 6 cardinal positions of gaze. And what I should see is that your pupils move in a conjugate manner. That means they move together to watch the object. And that's a normal finding. And then keep watching it. I'm going to move it close to you. There you go. That's accommodation. Wonderful. And what I'm checking with that is I should see that your pupils move in and that they constrict. And now just look straight at me, and I'm looking at your pupils. First I see that they're both round and they're equal in shape. You have fairly dark irises, so it does make it a little bit more difficult when you're checking pupillary light reflex with a darker iris. So just look straight at me. And what I should see is the pupil should constrict when I shine the light into the pupil, which it does. You can put your glasses back on, and then I would document it as perla, P-E-R-R-L-A. Pupils are equal, round, reactive to light, and accommodation. And then I'm looking at the eyes overall. Eyebrows, eyelashes, eyelids should all be symmetrical. And I'm sorry, you have to take your glasses off for me one more time. Can you look up? I'm looking at the sclera, which is china white, and the conjunctiva, which is shiny and pink. Okay, now you can really put your glasses back on. All right, and now I'm moving on to assessing the ears. First, I'm just looking at both pinna of the ears. I'm making sure the ears are in the proper location and symmetrical on the head. I'm looking in the auditory canal, the external, for any cerumen or earwax, which I do not see. And then I'm palpating the pinna. Is there any pain or discomfort with that?
No
You
pain.
can press on the tragus right here, the tragus, to see if there's any pain here. And I do notice that there is a piercing there, just the one piercing. So everything looks okay with that, and then I'm going to do the whispered voice test, which is cranial nerve number 8. I'm going to say something and you're going to repeat it to me.
Okay.
Okay? Black shirt.
Black shirt.
Black shoes.
Black shoes.
Wonderful. So he did well with that, so I know that cranial nerve number 8 is intact. And so that concludes our assessment of the eyes and the ears.